Hi, hello. We're here with Donna, and hi Donna, could you introduce yourself and explain your position for everybody?
Okay, my name is Donna Offner. I'm a physiotherapist with the Windsor Essex Community Health Center Chronic Disease Management Program, and I run the circuit training for clients that have had neurological impairments at the St. Denis Center, and actually we just finished our semester, so we just wrapped it up for the summer.
Okay, good. Could you tell us a little bit about what you do?
Okay, basically, clients that have been either discharged from rehab at the Windsor Regional Hospital or they've not been exercising for many years, basically don't have anywhere to exercise. They do not fit into that category of joining a gym, joining group fitness classes. There really isn't anywhere for them to exercise. So we've developed a program that allows them to exercise. There's no charge for the program, and we're basically trying to keep them out of the hospital, out of emergency, and helping them improve their quality of life. So hopefully their independence level stays as high as possible. So they come to exercise at the program after I've done a functional assessment, and we have a lot of volunteers, a lot of kinesiology students help us. And we run this program 2 days a week at the St. Denis Center, and we also have a therapeutic pool program at 80 Knox 2 days a week.
Wow, that's awesome. In your experience with these patients, how would you say a stroke affects individuals' cardiovascular system post-stroke?
It's devastating because their mobility, most of them have very poor mobility once they've had a stroke. Now there are varying degrees of severity of stroke, but for the ones that are very severely affected, that means they have no strength in their arm or leg of the affected side. They really cannot do any kind of cardiovascular exercise. So as they recover, and they do most of their recovering that first 6 weeks after their stroke, but as they recover, they're very gradually improving their mobility, but they really never get to that training level where they have their heart rate up to that target heart rate range. So they never really can exercise hard enough to get to that level. So they really have poor cardiovascular health. Once they reach a level, though, of like maybe they've been about a year after their stroke, they really can improve their cardiovascular system, though. This research has shown that even a year after stroke, 2 years after stroke, you can still improve your cardiovascular health.
Okay, and like along the same lines, do you notice any changes in their breathing, their lung capacity between a normal person, let's say, who hasn't had a stroke?
I don't really have a lot of clinical experience with that, but I can tell you that shortness of breath is definitely an issue with anybody that's had a stroke. They really are not in good cardiovascular condition, so they really don't have very good quality of breathing. So I would say that they would definitely not be able to do very much without getting a lot of shortness of breath.
Okay. So after an individual has a stroke, how long do you recommend they wait until they join an exercise regime or program?
That's really up to the doctor. When the client has had, or the patient has had the stroke, they're in the hospital, the doctor decides when they're stable, and when their condition is stable, a physiotherapist will see them in the hospital as soon as possible and have them sitting up, have them working on their sit-to-stand transfers, the very basics, and they will start walking as soon as possible. So as an inpatient, they'll have exercise right away, and then they'll be transferred to rehab, and they'll be in rehab for several months, and then after that, then they're discharged to the community, and at that time, they definitely need to exercise.
Oh, wow. Okay, so in your experience, would you say that exercise is beneficial for someone post-stroke?
It's critical.
It's critical, so wow, okay. That's sufficient enough. So when you were designing a program for someone post-stroke, what goals, any specific goals you have in mind?
Yes, function. They have to be able to perform their activities of daily living, which is dressing, feeding, bathing, anything like that. So all the exercise needs to be geared to doing functional activities. So you want them to be able to walk, you want them to be able to get up off a chair, you want them to be able to dress themselves. So the exercises can be very specific to their function.
Yeah, that makes tons of sense. So what do you find to be the most effective exercise cardiovascularly for patients? Specific exercises that you work with?
Well, what we're doing right now at the St. Denis Center is we have a couple of, actually our circuit is divided into leg exercises and arm exercises. The arm exercises that we do for cardiovascular are the arm ergometer, and it might only be the one arm that they're going to use for the cardiovascular exercise. And we also have them doing step-ups, so they're going to step up, and they're also, for function, going to step down. So they might step up, step down, turn around, step up, step down. So I've incorporated turning, stepping up, stepping down as part of their cardiovascular exercise. But probably the one that's the most critical is just walking on the track, some gait training, but mostly just building endurance with whatever walking aid they might be using, which is generally a quad cane.
Okay, that's good. That's awesome. So, do you personally recommend weight training for these individuals? Why or why not?
Weight training, as in free weights?
Any form of resistance
Any form
training?
of resistance, absolutely. In a lot of cases, they have strength to lift more than their body weight, or that lift, and I'm saying like even like a sit to stand, they might need to hold on to a dumbbell to add more resistance. The same as with anyone else, you have to make sure the exercise is challenging. It has to be difficult to finish the last few repetitions. So if body weight alone or just lifting the limb alone is not enough to get that fatigue, then you have to add resistance. So it could be tubing, it could be a free weight. We don't have access to equipment where we are, but we definitely, and I mean like machinery, but we do have free weights. So they're all using free weights of their unaffected arm, and some of them, it depends on how weak they are, they might also be using resistance if they can tolerate it. So absolutely, yes, they should use resistance if they need to be challenged more.
Okay, good. All right, so what kind of role do you find that balance and flexibility play in in these programs?
Well, for people that have had a stroke, they are definitely going to lose flexibility because they tend to have a lot of tone in certain muscles that have been affected. So they do have to work on range of motion, flexibility. That's very important. Otherwise, they won't get proper function out of that limb. Also, balance is critical because that's probably one of the biggest deficits that someone with a stroke has, is that their balance is very poor because they're not weight bearing equally on both legs. So we've created a balance station where they have to work on walking a line, just standing one foot directly in front of the other, and their balance is generally very poor, but balance, just like strength, can improve very quickly, and if you just keep doing the balance exercises over time, their balance will improve and hopefully prevent a fall. So the balance exercise, and it can be with minimal equipment, can really improve, and it's a very important part of their exercise program.
Okay, awesome. So overall, could you kind of just sum up why exercise is beneficial for post-stroke patients, and why it's not a safety hazard or anything else?
Well, as far as safety goes, of course, balance is one of the biggest concerns that we have when someone with a stroke is exercising, because they aren't able to weight bear equally on both legs. So that's something we always work towards, trying to get them to weight bear on their affected side, which can cause balance problems. So they always have to have a standby assist.
Okay.
And that's why we have someone standing beside them at every station to make sure they don't lose their balance. So standby assist is important for sure to maintain balance, and also to help make sure that the client is using the equipment properly. You have to be helping them stand by when they're doing their exercise. As far as the exercise is very important. They need to be strengthening as much as possible so they can improve their daily activities and also prevent injury. If they're not exercising properly, if they're using resistance maybe when they shouldn't be using resistance, it's very important that we make sure they're using safe technique. So exercise is very important. They have to be doing as much as they possibly can to be as independent as possible to stay living in their home, to stay out of the hospital.
All right. That's awesome. Thank you, Donna, for your time. That was
You're welcome.
great.
You're very welcome.